Good morning and welcome to the 2018 Southern California National Healthcare Summit. We have a comprehensive agenda for you today. We have definitely a lineup of all-star experts in the health industry that are going to share their insights and best practices on how to hold the line on healthcare affordability. I am Liana Bailey-Crimmins. I am the CalPERS Chief Health Director, a board member for the National Coalition on Healthcare, and I am honored to be one of your co-chairs for this very amazing event today. For those of you who don't know a lot about CalPERS, we serve those who serve California, and that entails for health 1.4 million total covered lives. We are the largest public health care purchaser in California and the second largest in the nation. We spend basically $9.3 billion on health benefits and $4.6 billion on long-term care services. So last September, I also had the privilege of co-chairing the Northern California event, and there was 175 people in attendance. So not only do we have you, who's who in Southern California in healthcare, we are also live streaming to ensure that people that are interested in this very important topic get to listen in to what we're going to discuss here today. Our objective is to basically build upon the themes, findings, and insights that the National Coalition of Healthcare has facilitated across the nation over the last several months. And during the presentations, you will have three takeaways. The first is the range of factors that are driving cost up and actually how we can be effective of combating that. The second is strategies and policies on how to affect the industry. And then lastly, a list of best practices on truly, you're going to hear some people that have actually shifted the market. Can I see by a show of hands, how many of you get inspired by these type of events? Woo! Yeah, we get to share, we get to talk to our colleagues, but then you get in your car and you show up for work at 8 o'clock tomorrow, and then we just kind of go and deal with these individually, right? I would like to challenge you today. My challenge to you is the same that I had for Northern California. The dialogue needs to continue. Our united front needs to continue. Network, make sure you get your connections, but it's not just a one-time event. If we're really going to impact this network or this industry, we have to be having these dialogues all the time. And so it's such an honor to be a part of the National Coalition of Healthcare because that's exactly what we're doing. And I think you would also agree that we are much stronger together than we can ever be individually. And the only way we can do that, you're going to hear a lot from the presenters today, but the success of today's event is about participation. It means we want you to ask questions. We want to hear your stories because we learn just as much from you as you do from us. So I'd like to now introduce my other co-chair, Mr. John Rother. He told me I didn't need to tell his bio, but I'm going to tell it anyway, so I'm so proud of him. He is the president and CEO of the National Coalition of Healthcare. He's also seen as a major change leader. I've had the privilege of knowing him for only a year. Probably many of you have known him longer. But he works with over 80 member organizations to achieve comprehensive health care. Prior to joining the coalition in 2011, he served as Executive Vice President for Policy, Strategy, and International Affairs for AARP. He has also served as a staff director and Chief Counsel for the U.S. Senate Special Committee for Aging. And in 2010, Mr. Rother received a Robert Ball Award for Outstanding Achievements in Social Insurance for lifetime advocacy to strengthen Social Security and Medicare. Please put your hands together and help me welcome Mr. John Rother to the podium.
Good morning, everyone. First of all, thank you for being here. This is the sixth such event that we've been holding around the country, courtesy of support from the Betty and Gordon Moore Foundation, which is based here in California. And the purpose of these is to lift up some constructive ideas about what to do with the problem that we are facing together and that problem is lack of affordability in healthcare. And my role today is going to be twofold. One is to briefly summarize some of the data that illustrates why this is an urgent problem, what the trends are. And secondly, to introduce 4 outstanding presenters that will follow me, and hopefully we'll have time to interact with each of them.